let us talk about the antidotes of different poisons. Some antidotes are used in multiple poisonings, whereas some poisoning has multiple antidotes. So start up with the aluminium poisoning and iron poisoning. Both of them has the same antidote, which is desferrioxamine. You have the ferri means iron, so it's easy to remember that it's a antidote for iron, but also remember it's antidote for aluminium poisoning. For copper, you have D-penicillamine, and this drug is typically used in patients with Wilson disease. Then for arsenic and lead poisoning, we have DMSA. What is DMSA? DMSA is dimercaptosuccinic acid. That is DMSA, used for both arsenic poisoning and lead poisoning. Then for benzodiazepine poisoning, we can use flumazenil, but that's rarely used because flumazenil increases the risk of seizure. So it's probably good to use only for when you have cardiorespiratory depression from benzodiazepine overdose. For beta blocker, initially we can use atropine, then we can use glucagon. We're using atropine because beta blocker overdose usually causes bradycardia and atropine reverses it. But in severe cases, we might have to use the glucagon. Atropine is a classic antidote for many agents, starting from beta blockers, calcium channel blockers, and both of them causes bradycardia. Atropine reverses the bradycardia. In nerve agent poisoning or OPC poisoning, atropine gives an anticholinergic effect compared to the cholinergic action of the nerve agent and the OPCs. So OPC and nerve agent has a cholinergic action. Atropine reverses this by having an anticholinergic activity or action. We can also give pralidoxime and obidoxime, which prevents aging or slows down the aging of acetylcholinesterase, ACHE. This is the enzyme that is destroyed by the nerve agents or OPC. And pralidoxime, obidoxime tries to recover the enzyme from destruction by OPC or nerve agents. For carbon monoxide poisoning, the main antidote is oxygen, 100% oxygen. That is the best treatment for most of the cases. For cyanide poisoning, we not only use oxygen, but we also have to use other antidotes such as sodium thiosulfate and hydroxocobalamin. For cyanide, sodium thiosulfate and hydroxocobalamin. For ethylene glycol poisoning and methanol poisoning, the classic antidotes are fomepizole, but you can also use ethanol if fomepizole is not available. For digoxin poisoning, we have to use the antibody fragment, the DG-Fab, digoxin antibody fragments. Those are the monoclonal antibodies that combine with digoxin and neutralize its action. Oleander poisoning also has a digitalis-like effect because it has digitalis inside it. So someone takes the flower of oleander and then he develops the poisoning features like digoxin, give digoxin Fab. In methemoglobinemia occurring after local anesthetics or occurring after giving dapsone or nitrates, the specific antidote is methylthionium chloride, also known as the methylene blue. For opioids, the classic antidote is naloxone, but be careful. If you give a high dose of naloxone, that can start an withdrawal response, which is also dangerous, so be careful. For paracetamol or acetaminophen poisoning, the best treatment, the best antidote is N-acetylcysteine. For warfarin, which is a vitamin K antagonist, you have to use vitamin K as an antagonist. In warfarin overdose, you have to use the antidote named vitamin K, because warfarin blocks vitamin K, you give vitamin K, and the name of the vitamin K is phytomenadione.